Hello, my name is Michelle Zechner. I'm faculty at Rutgers School of Health Professions at the Department of Psychiatric Rehabilitation and Counseling Professions. I've been helping people living with mental health conditions and their families for over 20 years. One of my passions is learning about new services to help people recover from mental health issues. Welcome to Mind Care Matters, a podcast series dedicated to exploring new and innovative strategies to improve mental health. Today, I'm so happy to be talking with my colleague, Amy Banco. Ms. Banco is a lecturer in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers. Ms. Banco is a teacher, trainer, consultant at the Integrated Employment Institute at Rutgers, where she facilitates trauma-informed supported employment and supported education training and technical assistance to enhance practitioner competencies and program outcomes. She co-developed the first mobile outreach supported education in New Jersey and has worked in this area for over 15 years. Ms. Banco has provided clinical services on multiple funded studies focused on post-secondary education and employment for individuals with mental health conditions. Additionally, Ms. Banco is a co-author of a best practice manual for providing supported education to transition-age youth and young adults with mental health conditions. She's a co-investigator on 2 federally funded studies on post-secondary education, supported education implementation, mental health conditions, and trauma. Ms. Banco uses her lived experience of a mental health condition to inform her roles as instructor, scholar, and clinician. Welcome, Amy. It's so great to have you.
Thank you so much, Michelle, for having me today. It is great to be here.
Wonderful. Well, so today we're actually going to talk about your passion and something that's very new to me, which is supported education and how it actually promotes mental health recovery. So I always like to start out by asking, what do you think mental health providers need to know about this topic? And I guess maybe start out with what is supported education?
So support education was developed in the 1980s by psychiatric rehabilitation pioneers from Boston University. And they built this particular modality of service to assist people with mental health conditions in obtaining post-secondary education to offset, right, some of those limitations of the evidence-based practice of supported employment, right? So since its inception, Michelle, SED, or that's the abbreviation for support education, has been an adaptation of the evidence-based model of supported employment, with the primary difference that SED assists in the acquisition of educational goals that ultimately will be leveraged to enhance future employment outcomes, right?
Oh, that's really great. So I didn't realize that SED is actually connected to SE. So those two programs are related.
Yeah, so historically, like those interventions that we utilize in supported employment have been adapted for support education in hopes of yielding similar rehabilitation outcomes. And so SED is essentially, right, that evidence-informed practice that provides comprehensive, stage-wise services. That's important. They follow the Boston University choose, get, keep approach. We've now added leave, right, to assist post-secondary students with mental health conditions in entering an educational program, and ultimately, Michelle, helping them to get to cap and gown. So SED practitioners will support college students in choosing their educational pathway, right? What are their interests? What are their preferences? And how can that be parlayed into a long-term vocational goal, right? And what is the education that they need to obtain that goal? And then the SED practitioner will assist that person in getting into their preferred educational program, right? People choose schools for very different reasons. Some folks may choose a school because it's closest to them, and that's where they can get in terms of their accessible transportation. Other people may choose a school because they have a really good disability office and they know how to support students with a mental health condition. And then the SED practitioner will move to keep, or maintaining their student status, helping them to stay matriculated. And I always say, Michelle, this is where that real work starts. It's easy to get into school, to choose a program, but to stay matriculated, to get to cap and gown, that can be challenging. And hopefully, right, that practitioner will help them leave the program successfully through graduation. All throughout these stages, right, services focus on skill development, resource linkage, advocacy for accessing their ADA rights, of reasonable accommodations, which is really critical because we know that students with mental health conditions have very high dropout rates in post-secondary education.
Yeah, that was going to be my question. So it sounds like it's really challenging, and it makes sense that if someone's experiencing a lot of symptoms as a young person and they want to go to school to, find a career path for themselves, they may be really challenged due to their symptoms or, other kinds of challenges like related to social determinants of health.
Absolutely. When we look at students and students with mental health conditions in terms of barriers to attaining post-secondary educational goals, there are significant barriers that can include the symptoms itself, medication side effects. Think about the age of onset of a mental health condition, right? Late teens, early 20s. What are you doing at that time? What is the mental health condition impacting in terms of skill acquisition, right? And so we may have to assist in really building up some of those skill deficits or the acquisition of new skills, right? That can be study skills, time management skills, all of those executive functioning skills, how to stay organized, how to stay motivated. Those are things that a lot of college students can struggle with, but especially students who experience a mental health condition. And you mentioned those social determinants of health. That is key. When we think about social determinants of health, right? Those are those non-medical factors that influence our health outcomes. And this is applicable to everybody, right? The World Health Organization looks at social determinants of health as conditions that people are born, grow, work, and live in. When we think about those factors, I see the base of those factors is the access to education and economic stability. Those two factors, Michelle, influence the other three primary factors, which is healthcare access, the neighborhood in which you reside in, and your integration socially and in your community, right? If you don't have post-secondary education, that is going to impact your economic stability by impacting your employment opportunities, right? And so when we look at education and accessing education for this historically marginalized, right, group of students, supported education is really a avenue of social justice opportunities, right? It helps individuals to access the educational environments that they may have historically been precluded from.
Yeah, that's very profound. I mean, it's, I hadn't really ever considered it, and I appreciate you sort of breaking it down for us, because it's about education is really community integration. It's really about normalization of, and sort of moving beyond one's illness and creating a new identity for oneself as a, fill in the blank type of person. And I'd really never thought about it as a social justice issue, but I think that really makes a lot of sense. I'm curious, what are the typical outcomes that are seen when students are participating in supported education?
Yeah, so when we think about the literature on support education, unfortunately, there are very few random control trials. We have one. And what we've learned from this one random control trial is that students enrolled in support education programs have a higher success rate in completion of their courses compared to individuals who may be receiving treatment as usual. Maybe they're linked up with VR, vocational rehabilitation, right? And so individuals receiving SED have a higher rate of completion of courses. We also note that they have greater improvement in the quality of their experiences with faculty, improved engagement in campus life, including those campus clubs, things of that nature. And they just report a better experience overall with their academic studies.
Yeah, that's really fascinating, and so much more is needed. I'm excited that you're doing this work. And what I also thought about as you were talking about the integration into campus is the importance of social support, and how it sounds like supported education can also help people connect to other people, whether that's their faculty and teachers, or whether it's other students on campus. So it also offers sort of that extra level of skill connection.
Yeah, there's robust literature that explores how people, students primarily, right, are more successful in their academic environment when they are embedded in the campus community and they are connected to classmates, right? That is a factor that impacts academic success. And so we want to enhance that as much as possible.
Interesting, interesting. Well, let's talk about some of the limitations that you note about supported education.
Yeah, so right now, unfortunately, support education is not funded in all counties of New Jersey, nor is it funded in all states in our country, right? And so not everyone is going to have that access to support education services, right? We don't have those funding mechanisms in place. I would say additional limitation is that lack of research, especially longitudinal research. We want to see, right? Does supported education ultimately get people to cap and gown? Does it help people to increase graduation rates? And so we see, again, those limitations can include, right, lack of funding mechanisms, as well as that robust literature. So we want to see, what are those longitudinal outcomes? What does it look like when people are engaged in support education services for a period of time? And does it lead to graduation? Can a person ultimately get to cap and gown as they're enrolled in support education services?
That's, yeah, those are really, really challenging limitations. But I think one question that comes to my mind, which I could just hear, I would be sitting around a table talking to a bunch of mental health providers, and I think it comes up for me too. So one question, would a limitation be, can people who are actively experiencing psychiatric symptoms participate in SED? Like, is that a limitation? Like, should people who are very symptomatic, should they wait until their symptoms get better to participate in supported education?
Great question, Michelle. When we think about eligibility for supported education, individuals who have a mental health condition, individuals who have more severe symptomology, persistent symptomology, right? Those are the people that this program was designed for, to help all individuals with mental health conditions, including those more significant mental health conditions, thinking of, schizophrenia, major depressive disorder, bipolar disorder, right? This service was created specifically to help these individuals to manage their symptoms and attain their educational goals.
Oh, that's really exciting. And that's really the link to me to mental health recovery, that people can choose the goal of education and go forward regardless of sort of what's going on with their symptoms or not. And this is designed to sort of support them in the process. That's great. I'm really curious, what are some of the trends that you see in supported education, or what about the future do you see more of?
Yeah, so there's a lot that is being explored currently in terms of support education. We are looking to support targeted populations, thinking of maybe veterans, right? And their needs coming back from service, getting reintegrated into jobs within their communities, right? So helping them to acquire, right, the educational training, support to get into a new career field. There is a lot of work being conducted currently for support education in first episode psychosis programs, helping people who are experiencing that onset of a mental health condition maintain their role as student and worker, right? They provide both support education and supported employment in these first episode psychosis programs to help people stay grounded in meaningful, normative developmental life roles, right? We also see a lot of work being done with support education in transition age youth. So really helping to prevent people from experiencing that gap in terms of secondary education and an experience of a mental health condition and getting enrolled in post-secondary education. So helping that person to transition seamlessly, right, from their teen years into young adulthood, again, maintaining their normative developmental life role of student and worker. And then we see also the integration of IPS and supported education, right? So that is the integration of supported employment and supported education to be provided seamlessly by one practitioner.
Oh, nice. So really sort of blending those models, which kind of makes sense, I guess, right? Because they're they're sort of related to each other so much.
Yes. So when I was providing services prior to coming to Rutgers, I was overseeing a program that had the integration of those two service modalities, and they fit very well. We would see individuals who are engaged in post-secondary education and supported ed, ultimately looking to obtain sometimes part-time employment, sometimes full-time employment. And so we were able to do that as we were cross-trained. It really is a very complementary model.
Yeah, and I think it's also so inspirational, like to remember why you're getting a degree or why you're going back to school. If you're not sure sort of what your career goals are, then you're sort of like, oh yeah, I'm doing this horrible class and I don't know why.
Right. And again, when you're thinking about building human capital, right, the experiences that a person has that they can leverage for future employment, it's really like the braiding of their educational experiences and employment experiences. It's very, very rare nowadays that you see a student in college that doesn't have some type of gig work, part-time work, etc.
Yeah, no, I know. And a lot of our students actually in the Department of Psych Rehab, most of our students work full time and they're often working in the field, but often other jobs as well. Yeah. Interesting. Well, so this has been so fascinating, Amy. I feel like I'm learning something new from you, and I'm so grateful for that. Hopefully our listeners are too. How can we learn even more about this topic if we want to go further?
Great question. Yeah, I would refer people to the Integrated Employment Institute website at Rutgers, where you can look at different research that we are currently working on in regards to support education. You can explore our training opportunities within IEI. I would also refer people to the SAMHSA website, where there is a supported education toolkit, free resource that offers great opportunities for people to learn about the provision of this service modality. There's also from Boston University, again, a free resource, a higher education toolkit that supports practitioners in working with students with mental health conditions and going through all of those services that I previously discussed, right? Looking at linkage to campus resources, helping them to develop accommodations, etc. There's also a Vet SED manual that is a veterans SED manual for that specific population of students, as well as the first episode psychosis manual that talks all about support education for this population of individuals.
Wow. Well, that's really great, Amy. I mean, this is the most comprehensive toolkits and manuals of any of the practices that I've talked about in this series. So I'm really delighted to know that there's a lot of information that's freely available if people want to learn more about supported education. So, well, thank you so much. Amy, is there anything that I didn't ask you or anything that you'd like to add before we wrap up?
No, I just hope that everyone who is listening is looking, for future opportunities to learn more about support education and hopefully fold it into their existing practices. I think it's something that really is profound and can help people to ultimately attain clinical recovery goals as well as those personal recovery goals.
Thank you. Thank you very much, Amy. Very, very much, very interesting conversation. I appreciated it very much.
Yeah. Thank you, Michelle.
This podcast is a production of the Northeast and Caribbean Mental Health Technology Transfer Center at Rutgers University and made possible by funding from the Substance Abuse and Mental Health Services Administration.